Good morning and welcome to all my dears. Today we are going to discuss about the investigation of irritable bowel syndrome. Investigation of irritable bowel syndrome. As you know, being a functional GIT disorder, in our clinical practice, it is very difficult to diagnose whether the constipation or diarrhea or alternate diarrhea and constipation, abdominal pain, etc. belongs to IBS. So that we have to do a well narrated, good, intelligent case taking first of all, and after having the case taking, we have to assess the symptom qualities, then doing the physical examination to exclude along with the symptom to any other pathology, organic disorder, and we have to screen the same for evaluation of organic disorder. And if all these physical examinations are negative for the possibility of such a organic or structural problems, we have to subgroup the symptoms of IBS, whether it is a constipation predominant or diarrhea predominant, or whether along with the mixed IBS, whether our patient is having any pain or tenderness or bloating, etc. After evaluating all those things, we have to do investigation in all patients. Investigation in all patients. Here, the word investigation in all patients means whatever may be the possibility of diagnosis. You know that it may be a case of gastritis or gastroenteritis or peptic ulcer disorders or inflammatory bowel disorders like ulcerative colitis or Crohn's disease, or even it can be a CA colon or CA stomach. In all those things you can see the symptoms of a patient with IBS. But at the same time, we have to exclude the above mentioned issues also. So, any patient with the symptom of GIT disorder, especially with IBS, we have to do with the first level. You can have the stool examinations. Stool examinations for series of occult blood possibilities, and with or without the occult blood, if our patient is having diarrhea, the same stool has to be evaluated for leukocytes or ova or any other parasites or bacterial pathogens, etc. has to be examined by stool evaluations. Then, after this, we can have the sigmoidoscopical examinations and barium meal or barium enema examinations are indicated to investigate in suspected case of irritable bowel syndrome. And at the same time, in selected patients of IBS, we can have the upper GI endoscopy, upper GI endoscopical examination, then ultrasound study of abdomen, especially with liver, gallbladder and pancreas. Then we can have the abdominal CT of abdomen. Then we can do the lactose tolerance test. Then finally we can advise our patient to have the mucosal biopsy of small and large colon. So, depending on the symptom severity, line 1 management is we have to do the routine investigation in all patients with symptoms of JHE disorders. But in selected patients, we can advocate with the ultrasound or CT or even biopsy to exclude the organic condition. But in a case of IBS, by doing all those things, mostly you may not get any positive findings. So that the investigation the investigation made for the diagnosis of IBS is to exclude all the other organic pathologies. Then only we can pinpoint that, sir, it's a case of irritable bowel syndrome, because it's a functional disorder, not a structural disorder. That's all regarding the investigation of a suspected case of irritable bowel syndrome. And next will be in another class that can be studied. Okay, thank you for watching.